As we grow older, many changes take place in our body, and one of the most common complaints people express after the age of 60 is joint pain. This discomfort often begins subtly, an ache in the knees when climbing stairs, stiffness in the fingers early in the morning, or a dull pain in the hips while walking. For many, these symptoms gradually become a regular part of life. But have you ever wondered why joint problems become so common after this age? The truth is, it's not just aging, it's a combination of biological, lifestyle, and even emotional factors that work together and affect the health of our joints. To understand joint problems, we need to first understand how joints work. Joints are the meeting points between bones. They allow movement and provide support to the skeleton. Each joint is cushioned by cartilage, a rubbery, smooth material that prevents bones from rubbing against each other. They are also surrounded by a special fluid called synovial fluid, which lubricates the joint and allows smooth, pain-free movement. The muscles and ligaments around the joints provide strength and stability. Over time, all these components start to wear down or function less effectively. One of the primary reasons for joint pain after 60 is the gradual breakdown of cartilage. This protective tissue can become thin or uneven due to years of use. This condition is known as osteoarthritis. It is by far the most common joint disorder among older adults. Osteoarthritis causes bones to rub directly against each other, leading to inflammation, pain, swelling, and a loss of flexibility. The knees, hips, spine, and hands are especially vulnerable. But osteoarthritis isn't the only culprit. In some cases, the body's immune system begins to attack its own tissues, including joints. This condition is called rheumatoid arthritis. Unlike osteoarthritis, which is caused by wear and tear, rheumatoid arthritis is an autoimmune disease. It can lead to severe joint damage if not managed properly. One of the primary reasons for joint pain after 60 is the gradual breakdown of cartilage. This protective tissue can become thin or another painful joint condition common after 60 is gout. This happens when uric acid builds up in the blood and forms sharp crystals in the joints, usually starting in the big toe. Gout attacks can be extremely painful and sudden. It may feel like the affected joint is on fire. Gout is often linked to diet, kidney function, and metabolic health, all of which may decline with age. In addition to these medical conditions, there are other important reasons why joint issues become more common with age. One of them is muscle loss. Starting from the age of 30, people naturally begin to lose muscle mass, a condition called sarcopenia. After 60, this process accelerates. Because muscles help support and stabilize joints, weaker muscles mean more stress on the joints themselves, leading to increased pain and a higher risk of injury. Body weight also plays a critical role. Extra weight increases the pressure on your joints, especially weight-bearing ones like the knees and hips. For example, every additional kilogram of body weight adds nearly 4 kilograms of pressure on the knees during walking. So carrying excess weight over many years can speed up joint degeneration and increase your chances of osteoarthritis. Previous injuries can also lead to joint problems later in life. If you had a sports injury, a fall, or surgery earlier in life, the joint might not have fully healed or may have been weakened. As time passes, these old injuries may begin to cause pain, especially as the body's natural healing capacity declines with age. Posture and movement habits developed over a lifetime can also affect joint health. Slouching, walking incorrectly, or repetitive motion in certain professions can put uneven stress on joints, leading to wear and tear in specific areas. Another factor that cannot be ignored is inflammation. Low-grade chronic inflammation becomes more common as we age. This invisible enemy can affect many systems in the body, including joints. It can worsen arthritis, slow down healing, and make everyday movements more painful. Diet, lack of exercise, stress, and poor sleep can all contribute to higher inflammation levels. Dietary habits, in fact, play a major role in joint health. A diet high in refined sugars, trans fats, processed meats, and junk food can promote inflammation. On the other hand, diets rich in vegetables, fruits, lean proteins, whole grains, and healthy fats can reduce inflammation and support joint repair. Omega-3 fatty acids, found in fish like salmon and sardines, have been shown to reduce joint pain and stiffness, especially in people with rheumatoid arthritis. There are also natural substances that can support joint health. For example, turmeric contains curcumin, a compound known for its strong anti-inflammatory effect. Glucosamine and chondroitin are supplements commonly used to support cartilage and may provide relief for people with osteoarthritis. Vitamin D and calcium are critical for bone health and can help prevent joint issues related to weak bones or osteoporosis. Hydration is another simple but powerful factor. The synovial fluid in your joints needs water to function properly. Even mild dehydration can reduce joint lubrication and increase friction. Many older adults do not drink enough water, often due to a reduced sense of thirst, but maintaining good hydration is essential for healthy joints. Physical activity is crucial for joint health. Contrary to what some believe, rest is not always the best solution for joint pain. Too much inactivity can actually make joints stiffer and weaker. Gentle, regular movement strengthens the muscles around your joints, improves flexibility, and stimulates the production of synovial fluid. Low-impact exercises like walking, cycling, swimming, yoga, and Tai Chi are excellent options for older adults. Stretching is also important. It improves flexibility, reduces stiffness, and helps you maintain better posture and alignment. Simple stretching routines in the morning and before bed can make a big difference in how your joints feel throughout the day. Sleep quality has a direct impact on joint health too. During deep sleep, your body repairs tissues and reduces inflammation. Poor sleep, on the other hand, increases stress hormones and can worsen pain perception. Aim for 7 to 8 hours of sleep each night in a dark, quiet, and cool environment. Managing stress is equally essential. Stress triggers the release of cortisol and other chemicals that increase inflammation in the body. Chronic stress can also lead to muscle tension, poor posture, unhealthy eating, and reduced physical activity, all of which contribute to joint pain. Mindfulness practices, meditation, deep breathing, and spending time in nature can help you stay calm and centered. You might also want to pay attention to your footwear. Wearing the wrong shoes can throw off your body's alignment and increase stress on your joints, particularly the knees, hips, and lower back. Supportive, cushioned, and properly fitting shoes are essential, especially if you walk or stand for long periods. Temperature can also affect joint pain. Many people notice that their joints ache more in cold or damp weather. While the exact reason isn't fully understood, it may have to do with changes in barometric pressure affecting the tissues around the joint. Staying warm, using heating pads, and dressing in layers during colder months can provide relief. Massages, warm baths, and physical therapy are also helpful ways to manage joint discomfort. Massage increases blood flow, reduces muscle tension, and can reduce stiffness. Warm baths relax both the muscles and joints, and physical therapy offers personalized exercises to strengthen and protect weak or painful joints. It's also a good idea to schedule regular checkups with your healthcare provider. Early diagnosis of joint conditions like arthritis allows for better treatment and management. Your doctor may recommend imaging tests, blood work, or even refer you to a specialist if needed. Do not ignore persistent joint pain. It's your body's way of telling you something needs attention. You should also avoid self-medicating with over-the-counter painkillers for long periods without medical advice. While medications like ibuprofen can provide short-term relief, long-term use can lead to stomach issues, kidney problems, and other side effects. Always consult your doctor before starting or continuing any medication for joint pain. Support from family and community is also important. Joint pain can make people feel isolated or dependent on others. Having a supportive network, staying socially active, and being involved in meaningful activities can uplift your mood and reduce the emotional toll of chronic pain. Remember, while joint pain is common after 60, it doesn't have to control your life. With the right knowledge, habits, and support, you can maintain your mobility, independence, and quality of life. Every step you take to improve your joint health, whether it's stretching, eating better, sleeping well, or managing stress, adds up. Your joints are meant to move, and the more you take care of them, the longer they will serve you. No matter your age, it's never too late to start protecting your joints. Listen to your body, be patient with your progress, and stay committed to your well-being. The goal is not just to live longer, but to live better. With less pain, more freedom, and greater joy in everyday activity. Joint health is not just a physical issue, it's deeply connected to how you live, think, move, and nourish your body every day.